Okay, great, thank you. We'll get started. So I'll be the first to admit Akule are running at Hawai Bay this evening. So I was considering skipping tonight's meeting. The crowd is a little bit lighter than I'd hoped, but we've got our friends from CLEAN, the Kapolei Local Emergency Action Network. We're very interested, and I know it's after hours for them. So we're going to record. They were interested in this session, and some of our other members aren't able to join us this evening, so we'll be sharing that with them and with all of you via email. Just to introduce this setting, this is the first return to deliver a public workshop for the Island Preparedness Group. For those of you that are aware of the Island Preparedness Group, we recently merged the two organizations from the Waianae Coast and Ewa Beach into one nonprofit. So this is our first delivery of a public workshop, albeit virtually. We thank you all for joining us. Just some ground rules. So I'll give an introduction of our guest speaker. Unless you've got a different setting he'd like to go through, I'm going to ask that we allow him to give his presentation, hold your questions for afterwards, and then we'll use the remainder of our time for a little bit of Q&A. If you have any questions, please feel free to drop that in the chat, and we'll make sure we'll get to those toward the end. So without further ado, our guest tonight is John Shear. John is the CEO and founder of Ready Zone HQ, a consulting company based in Honolulu. He is a certified emergency manager, a member of the International Association of Emergency Managers, and a past president of the Emergency Management Professionals of Hawaii. He has over 30 years of emergency management experience, which has included leading projects in 12 countries, dozens of US cities in 30 states, Washington, DC, and 3 territories. He was the lead planner for the development of the Department of Homeland Security and Department of Transportation's pandemic plans, and the Hawaii Department of Health Strategic National Stockpile and COVID-19 vaccination plans. He has supported the Hawaii DOH since 2014, conducting new exercises and training events. He has been serving as a consultant to DOH as the program manager for Hawaii's COVID-19 vaccination program for the past 9 months. That John is to the lead host. Most recently, unless I'm sure you've got other projects going on, but most recently, he was instrumental in supporting the Kapolei Local Emergency Action Network in completing their emergency resource guide. So updating that plan for the Campbell Industrial and the Kapolei area. So John, take it away.
Great, thank you. I was hoping Rodney would be here. If Rodney's not here, I'm not sure why I should be here. But, you know.
Yeah, Rodney's away on a family emergency.
Understood, thank you. All right, can you see the slides okay? Great. So appreciate the opportunity to be here. Have supported a couple events out at Kapolei in addition to the planning effort. For 2 years in a row, we did tabletop exercises for CLEAN. We did one focused on hurricane response, and we did another one focused on tsunami response. And so hopefully we'll be out there again one of these days to do some additional work, but just really appreciate the opportunity to be here. So we'll talk a little bit about the program and kind of where we came from, and then give the bulk of the discussion on where we're at right now. And then the idea is to really make sure that we're focusing on the way ahead and make sure we get some feedback from you if you have any thoughts about what we need to do differently when it comes to the vaccination program, and then leave plenty of time for questions if that's okay with everybody. So bottom line for the vaccination program, I think as everybody understands, this is the largest program in the world that's ever been undertaken to get immunizations out there as rapidly as possible. It does mean that we need everybody's engagement. It's not just a public health issue, it's really making sure the whole community is engaged. And the bottom line is that whole community means it's really in partnership between the federal, state, and local level, as well as private sector and nonprofit organizations. And that's one of the reasons we really want to make sure people are participating in this program and realize that that's what's our kind of goal from the beginning of the vaccination program, was to make sure this was not just a really top-down driven, state government approach and then kind of catching people up at the end of the program. We wanted to make sure that was involved from the beginning. So we've actually done over 100 working group sessions since we began this project back in September. And we just finished our 32nd core planning team meeting at 5 o'clock today. So I think everybody's probably heard this terminology when it comes to herd immunity and what it means to get there. It's one of the hardest things that you're trying to achieve when it talks about stamping out the response to a contagious disease. So this is kind of the things you're looking at is, you know, we really are trying to get to that 75%, 80% type of goal. You've seen the governor's press conference last week that specifically talked about what's going to happen as we get to greater and greater immunity within the state. So the latest change was as of yesterday, being able to do inter-island travel without restrictions. The next goal is the 60% of the total population, and then 70% is the next goal after that. When it came to the program itself, so we started on the 16th of September. That's when my team came on board to support the Department of Health. At that time, we had less than 30 days to get a plan in place that the CDC required of all 50 states to be able to turn those around, and that was a vaccination plan. And the idea was they didn't know when vaccines would be approved. They didn't know what the shape it would take, whether it was going to be Pfizer, Moderna, J&J. They didn't know any of that at the time. They just wanted all the states to have plans in place, and they set a deadline of the making sure that happened by the 16th of October. So we were able to put that into place, and we actually set up a test drill to take place at Leeward Community College, specifically to test the plan on the 14th of December. And it was really, we arranged that back in November to set up that drill in the 14th of December. And it just so happened that that's exactly when Pfizer was approved, and then Pfizer arrived within the state. So we were able to test out real time that week what we needed to do to operate one of these large point of dispensing sites. And the plan revolves around these three main priorities. The first one is really trying to make sure there's an operational structure in place to support the overall vaccination program. The second one is the one that I talked about previously, is making sure there's a broad group of stakeholders that have been engaged throughout the process to really help us target the critical populations that need to get vaccinated. And then last piece is to make sure that we're getting the word out. You can have the best program in the world. I think, as you guys know, when it comes to all of the efforts that you've done out there, and if nobody is aware of them, then it really is a challenge. And so I think the kind of the Eva Beach community fair that takes place, you know, around the preparedness month in September is a great example of, once you get the word out, people kind of come together and they know that that's what needs to take, but you need a really effective communications campaign to make that happen. So we wanted to make sure people are aware of it's a safe vaccine, it's an effective vaccine that's out there. We want to make sure people are coming back for second doses. And we want to make sure that we're really working to raise awareness if there are adverse events, like we saw with J&J, where we stopped the process, rapidly turned that around, waited until we had additional safety and efficacy information before starting Johnson & Johnson again. So we did have phases that we developed, and the first one was we assumed that there would be potentially limited doses available. We were told by the federal government that there was going to be 350 million doses available by the 1st of January. That didn't happen. All right, so when we first worked it into the planning assumptions, we knew that there was going to be potentially limited doses and what that would need to look like. And that's when we worked with the entire community to come up with prioritized groups of who would receive the vaccine. Then we knew that we were going to move into a phase where there's a large number of doses available that could meet the demand. And that's kind of what we went into probably towards the March, April timeframe. And then around the second week of April is when it basically fell off a cliff, and all of a sudden there was plenty of vaccine around, but then there wasn't as much demand. And so that's what we're in right now, is that sufficient supply, slowing demand, and we're trying to work on what we can do to make sure that we keep getting vaccine out there as rapidly as possible. So this just kind of gives you an idea of the vaccination program timeline and what that looked like. So we did our first program project kickoff meeting on the 23rd of September, and that kind of looks at how rapidly things were happening. So the 16th of October was when that plan was published. The 11th of December was when the FDA issued what's called an emergency use authorization so that Pfizer could be used. We did that drill, like I mentioned, on the 14th, and then the first doses arrived that day. And so we had very little time to react throughout this whole process. Typically, the federal government was giving us maybe a day's heads up. We most of the time found out about it through the media, where they say, oh, by the way, we're going to open up to the entire population on the 19th of April. And we'd find out about that on the 18th of April, those type of things. So it's been one of the challenges of this project, is how rapidly things change and how quickly we find out about information, whether it's Moderna being approved. you can see that that was something that, you know, when that happens, they issued approval on the 18th of December, and the first doses arrived 3 days later. And so that's how quickly we needed to be able to respond to these things when the vaccine was coming in on board. Same thing basically happened with Johnson & Johnson, and we're expecting the same thing could happen with additional vaccines as they get approved. So the other piece there is some of the other things, like I mentioned, with the J&J doses being stopped, the big push to expand eligibility 16 and above on the 19th of April. That was not what the state of Hawaii wanted to do. We really wanted to slow down the process, make sure we got to some critical populations, and then open up that process on the 1st of May. And the government said, no, you're going to make sure that happens on the 19th of April. And we were able to make that happen. But what we think occurred was that did slow down the demand, because instead of being this restricted supply, all of a sudden people just realized they could go whenever they wanted to. And then that kind of stopped the process of getting people out as quickly as they could. The other big thing that's happened recently was, you know, getting the ages of 12 to 15-year-olds approved, and that just happened on the 10th of May, so not that long ago. And then that the other type of thing is getting that additional travel restrictions lifted as that's continued as today. There were a number of challenges that we identified back in September when we thought about this new vaccination program and what would happen. That first one there is probably the most critical for this group in particular, is that prioritizing critical populations. I think the rest of these we probably worked through fairly rapidly. When we first started, there was no ultra cold capacity to speak of throughout the entire state of Hawaii. Now almost every hospital has an ultra cold freezer. Most recently, Waianae Coast Comp just got an ultra cold freezer, and so they've got that capacity right now. Most of the other sites did not have anything like that. And like I said, now Queens Medical West has got an ultra cold freezer, Waianae's got an ultra cold, and almost all the other hospitals also. The critical population piece is where there's basically out of 330 million people in the United States, probably 200 million can claim to be part of an essential population group. And so we had to try to figure out in December, January, February timeframe, how are we going to get vaccine out to the people that really need it, where we only have a very limited supply? We were getting maybe 20,000 doses a week, 30,000 doses a week. And obviously there's, you know, over 1 million people that are looking to get that vaccine. So that's what we were working through that problem set. So, you know, it really did help to get input from the community to identify who are the essential people that need to get vaccinated, and obviously to work through the different populations like the kupuna to make sure they got their vaccines as rapidly as possible. And so this kind of shows just a chart that we put together in the plan that said, what are the phases, who's able to get vaccinated, what does that population group look like? And then one of the other pieces to this is, you know, because, you know, we've been working in Hawaii for years, I've been here for almost 11 years. The idea was we know how everything can kind of be Oahu centric, and we wanted to make sure we took into account the neighbor islands from the beginning. And so we really did a hard look at what are the requirements for the counties, what are the things that they need for their populations. And that's kind of where this comes to be able to break down, is to look at those population groups and say, what do we need to be able to vaccinate them? And we're right here in phase 2, where everybody that wasn't previously recommended has been able to get vaccinated, and we're working through these groups as we speak. The latest thing as of this information, you know, some just released as of today, with things like, you know, the additional vaccine that the U.S. has been purchasing, the information from a few days ago about Novavax is another vaccine that might come online soon, really good efficacy rates. And then the other piece to this is Johnson & Johnson. Originally it had a 3-month shelf life, and that just got extended to 4.5 months. So that's another area where, you know, we could use help from community. If you have people interested in J&J, we have about another 6 weeks or so to be able to use the existing vaccine we've got on hand before that expires. This just gives you a feel for what that uptake looks like that I mentioned. So this is nationwide, what that looks like as of today. So you can see how there is a spike that happened, you know, as the vaccine supplies got there. There was a tremendous demand. We were able to meet that demand. It continued to grow. And then you see how that just fell off a cliff as you get towards that 16 April, you know, 19 April kind of timeline. And then you can see how that's continued today. So this is something where it is really of concern to make sure people understand that they need to get vaccinated as rapidly as possible. if we're going to get out of this. And especially when it comes to variants, most of the Delta variant is one that's you've heard of recently that's of most concern, more transmissible than other variants. And the question is, can we get people vaccinated quickly enough? And it's not just the first dose with these variants. A lot of the time it needs to be fully vaccinated. So that means they need to have that second dose 3 to 4 weeks later. And then 2 weeks after that second dose is where they get full immunity. So if you start today, you're still looking at 3 weeks before the second dose or 4 weeks, and then another 2 weeks after that. So it's about a 6-week timeline you're looking at if you can get people vaccinated as rapidly as possible. This just gives you a feel for what that looks like nationwide. And so a lot of times people have been questioning, why is the state focused on the total population versus the population that's eligible? Right now, the ages of 12 and above are eligible. So the question is, why don't we set our targets based on eligible population? And from an epidemiological standpoint, the vulnerable populations of about 200,000 children that we have below the age of 12 need to be protected by the rest of the population that can be vaccinated. So what we're trying to do is the 70% of the total population means really we need to get about 80% of the eligible population to make sure that 70% of the total population is vaccinated, because the children probably aren't going to be able to get vaccinated that are below the age of 11 until the fall. That's probably when the test will be able to come back and the emergency use authorization will come in. So if you've got kids or grandkids that are interested and you're trying to get them vaccinated, it's probably closer to the fall timeline. So they need to continue the protective efforts to date to make that happen. One of the success stories in Hawaii has definitely been the vaccination of 65 and older. You can see what that looks like throughout the country. It's been really positive news. This shows the percent with first doses versus fully vaccinated. What you'll also see is there is difference in what's reported on the CDC's website versus what's reported on the Department of Health website. Use the Department of Health website. We're reporting 1.6 million doses to date. That is more accurate than the CDC, which is reporting 1,645,000. The CDC has been double counting some of the doses we've been sending them. So we'll have a pharmacy send information to the CDC, and then the Department of Health sends information. They're double counting that. We've been trying to resolve this for a month or so now, and we still haven't gotten them to resolve the data feed. So focus on what you're seeing here, because the CDC is actually over-reporting the number of first doses we've administered, and they're under-reporting the number of completed doses. So that's why you want to look here. The CDC is reporting that the state of Hawaii is vaccinated less than 50% completely, when actually we vaccinated over 55%. So that's why you want to use the DOH data. And that's the location is that hawaiicovid19.com site. The other thing is just to show kind of how rapidly this happens. So this is data from May 26th or May 27th. And so you can see it's now June 16th. So just in about 3 weeks is how we went from 1.5 million doses up to 1,621,000. So basically it's about 40 to 50,000 doses a week is what we're trying to get out the door. And if we can keep that pace up, we're doing great. If we start to drop below 40 and 30 and 20, this is going to take a long time to resolve. And so we want to make sure we're getting second doses into people, we're getting first doses. And this just shows it's a combination of the jurisdiction, what the federal agencies are doing. So that's DOD, Veterans Administration, Bureau of Prisons, and then the federal pharmacy program. That's all of the pharmacies throughout the state. So there's over 170 pharmacies that have participated in this program. You can go to the Walmarts, Longs, you can go to Costco. It's just a tremendous amount of availability at these pharmacies. They tend to have later hours, and they also tend to have more weekend hours than most of the pods that are run by the hospitals. And then this just shows that there is age-based data that just has been shown for the last several weeks. The challenge is it's not showing that federal data. And so it doesn't show on Oahu the fact that there's 150 some thousand of those doses out of the 160 some thousand have been administered here on Oahu. So that's probably this 18 to 49 age group is probably about 5 percentage points lower than it actually is. So we think that we're doing much better in these areas, and we know that we're doing much better in these areas because of all the doses that the military has administered in the state of Hawaii, but we can't report on that yet because we were only able to see the jurisdiction of pharmacy doses. The federal doses are kind of embargoed at that point. You can go to the website and click on the different population groups. So you'll see 12 and above, it'll have 18 and above and 65 and above if you want to see what that looks like. And then the other piece here is this is new information that's showing right now, and that's you can drill into zip codes and see what the vaccination rate looks like by zip code. So I'll show you what that looks like here. If that's okay with everybody, I'll show this live. So basically, if you go to the Department of Health's website, you'll see this vaccine tab. You click on the vaccine tab, that shows the figures I was showing. You can hover over them, and that shows that information that we were talking about. So total initiated versus total completed. Basically, you know that 3 to 4 weeks from now, we're going to be at 61% of the population, because that's about how long it takes for people to complete their second doses. You'll see that down here is that age-based data that I was talking about. So right here, this is showing 12 and older, and then it takes a minute to refresh. And then what that looks like is you can show who's fully vaccinated, you can show who's initiated. It has these other bars that talked about, and then you can click on this map one, and the map information is going to take you to this view. You can click on the county. And what that allows you to do is to hover over a particular zip code and see what the population vaccination rate looks like. This is updated every day. So as vaccination efforts happen, we can definitely move the needle, and you'll be able to see this here. So as there's vaccination efforts that are happening in schools and the community, you'll hopefully see these start to inch forward and get into these next groups. And so you can see that you can even click on the bars and it'll highlight the particular areas. So you can see throughout the county, these are the ones we're focusing on right now. So we have locations we've identified to try to increase vaccination in these areas, and then any areas that are below 50% we're also looking at. And then you can see some of the areas that have more saturation. Some of these obviously are smaller populations, and so a small percentage of people getting vaccinated is going to have a big impact on getting that to the next level. Okay. The other thing you can see is age-based information. And so if you look at the age-based information, you can see which is the population group we need to focus on to get vaccinated. Let's focus on Honolulu. Who needs to get vaccinated? Anybody want to come off mic and let me know?
Sorry, what was the question again?
Which age group needs to be vaccinated?
Or you got cut off.
So which age group needs to be vaccinated? Bob, did you have anybody?
I don't know if this is a trick question, but all of them?
Yeah, Kupuna.
Kupuna are doing really good. So 92% have been vaccinated or at least started the process. Look down here. 18 to 29-year-old group has only had 44%. The 30 to 39 group has only had 51%. 40 to 49 has had 64%. These are the groups we need to focus on. The 18 to 49 group, we need to get them to the same level as the Kupuna. That's the idea. All right, so the focus here now for the 12 to 17, they're doing a fantastic job. They've had 4 weeks to get vaccinated, and they're already up to 46%. The rest of these groups have had since December to get vaccinated for the most part, and it's taken a long time. So the idea here is that we want to really focus on these additional groups and make sure that the 18 to 49-year-olds have the opportunity to get vaccinated. If you're an employer, give them time off to get vaccinated. Make sure that people are able to get out there and do what they need to do. All right. The next thing is just the vaccine distribution efforts that were taking place. And it started back in May with the Department of Education. So around the 6th of May, we started additional vaccination efforts focused on schools. So we've got 200 events throughout the state focused on vaccinating school-age children at Department of Education and non-DOE sites. This is what we pulled for this zip code, so that were shared that might be of interest to you. So in the Kapolei area, that's one of the areas you saw was one of the lower vaccination rates. We looked specifically at these particular locations. The ones that are kind of an orangish color are the ones that are existing locations. Now the Kapolei Theater, if you didn't know, is going to be ending their operations on the 19th of June. So that's this Saturday is their last day. And then they're going to be shifting their efforts over across the street to they have a clinic that's located close to that. But you can see that the other locations that are listed there, we looked at potential locations. And then what we did was we looked at locations that might have had Long's or other provider co-located there. So instead of sending Queens to go to the Kapolei Commons, we're like, why would we do that if there's already a Long's? And so what we're looking at for these locations is, in particular, trying to get things like public health nurses there, do community outreach events, pull people into the stores to make sure that they understand they can get vaccinated. Obviously, the Wet and Wild events that are taking place are new. The first one just happened the 5th of June. There's a couple other ones that are scheduled that are coming up quickly. 18th of June is the next one, so that's this Friday. And then you can see some of the other ones that are listed. Any questions about events that are scheduled for the Kapolei area? You can see the farmers markets.
I know Hi-Fi was going out, actually doing outreach to like the public housing sites.
Yep.
Are there teams in our area actually going out to these neighborhoods?
Probably not as much neighborhoods. They're probably centered around the vaccination locations. But again, if there are events that are coming up where you'd like to invite anybody into to provide some of that community health outreach, let us know and we can try to get speakers there to be able to provide support. If there's any events that are happening already, like we mentioned, the farmers market, other ones you can think of, let us know. We could try to get people out there. But Hi-Fi is just one of the ones that have been providing support. The public health nurses, the National Guard, and the Medical Reserve Corps have all signed up to provide support. Some of the latest ones, the zoo is going to have some events taking place, and that's where they're going to do some outreach there. This is what we've got for Waianae. So some of the locations we work with the particular owner of the properties, or there might have been another reason we ruled that site out. This is obviously not capturing all the different locations there. This is just some brainstorming that took place with the planning team. You can see some of the events that were scheduled here, and then obviously the other ones that already have existing. Obviously, Waianae Coast is doing a tremendous amount of work and going out to different sites to include schools. And then we've got Eva, so Eva Beach area, where my wife works. So you look at the different events they've got kind of scheduled. So the existing locations. And then the times in hour and days. And then the last one was, and then I think I have this listed twice. Okay. So that's all I had for that one. So any questions about the locations and some of the events that are happening for the month of June when it comes to that?
Nope.
Great. So let me talk about the way ahead. So we're right here from the 19th of April to the present, which all persons age 12 and above, not previously recommended for vaccination. So it started as 16 and above, and then we're able to get around the 12th of May, I believe, is when the 12 and above were able to be eligible. The idea is that we've got this targeted community outreach campaigns, the High Got Vaccinated campaign, the DOE campaign for 12 and above. We are looking at what might need to happen for the age group that's under 12 into the future and what that might look like in the fall, and then mobile efforts like we mentioned. So there's over 500 locations throughout the state of Hawaii this month where people can get vaccinated. That's a combination of fixed sites and mobile sites. We are looking at to enroll independent providers, so going to your local doctor's office to be able to get whether it's a pediatrician or other types of specialists that are interested. The retail pharmacy programs obviously can continue into the future. And then for the hospitals, they started to look at using emergency departments, outpatient and other clinics to make that happen. The vaccination campaign that I mentioned, hopefully you've all heard about it. Hopefully you've all registered. If you haven't heard about it, please make sure you register. The whole point is you have an opportunity to kind of get all kinds of prizes out there. The idea was to try to address the issues I mentioned before with the slowing of the uptake, that large gap in the 18 to 34-year-old group. And in particular, there's a bunch of people that said that they want to get vaccinated, but they said, yeah, not yet. And so we're like, yeah, now, do it now. Don't wait. Don't wait until do it now. And so that's the whole purpose of teen incentive campaigns. So bottom line is we know we can't get back to normal until we get more people vaccinated. We want to make sure people are caring for yourselves, their family, the community, and then obviously get their independence from the pandemic by the 4th of July if we can. It includes the accessible locations, the incentive programs, and then public health education. So this is what this website looks like. It's at highgotvaccinated.com. This is a screenshot of the site. I'll pull it up so you can see what that looks like, if that's okay. Let me see if I can grab it. So this is what the site looks like. You can go onto the main page, the howigotvaccinated.com, and I'll drop that into the chat if I can find the chat. So, all right. And what you can do is it shows you can register here. All it asks for is name, email, phone, address, and you click that you're above the age of 18, you fill out the CAPTCHA, that's it, you're entered. So the first prizes were awarded today. The prizes include things like Hawaiian Airline miles, Southwest Airline miles, Marriott points, lease of a car for a year. More important for me is Zippies for a year. Other things like the trip to Las Vegas. So there's a bunch of different things that the private industry's really stepped up to the plate to help out with. So all you have to do to be able to register, like I said, is click on that front homepage and you're in. And hopefully by the end of the discussion today, everybody here will have registered. For the deals and discounts, you just need to show your vaccination cards. So this is not just for people that are getting vaccinated in the month of June. If you already got vaccinated, you just show your vaccination card, and then you're able to get access to any of these deals and discounts. So all those are listed here. And once again, the idea is to try to get people out the door to make that happen. If you do have the ability to offer a deal or discount and you're interested, the window on that's closing rapidly. So make sure you go to the site and it'll talk about where you can offer and click here. And I think they're going to close that by the end of this week. So again, if you have your own business and you want to offer a discount to people for vaccinations, make sure you do it sooner than later and make that happen. And then that's what the site looks like. So any questions about that? All right, remember, we'll share the slides so you guys will have this too, but I did drop the link in for you. Okay. So bottom line is there's over 500 sites, like I mentioned. It's 450 was when the slide was created a day or so ago. Working on social media, get the word out. There's How I Got Vaccinated stickers that are available. This is what you'll see on social media. So if you can help us out and share that if you're on social media, Instagram, Facebook, Twitter, whatever, if you see this posted, a lot of the community organizations have been really helping out. So like Papa Olakahi does a great job. We Are Oceania does a great job. Go to their Instagram feeds and help them out to kind of share information about what's taking place, or Facebook along those lines. Make sure people are aware of the incentives. Once again, when you send the meeting notes out from this, if you could send out the link so people know where they can go to get those incentives, that'd be great. And then bottom line is that we've had over 200,000 people have entered so far, and it's a much better winning percentage than most other efforts that are out there where it's entire population. You got 200,000 other people you're competing against at this point, and then obviously some media support that's out there. And this just shows the timeline. So if you want to make sure you're in the running for that next round of 100,000 Hawaiian miles, you got to make sure you've entered by Thursday, June 17th at midnight. So you got one more day to make that happen. You don't need to enter multiple times. It's only one time, and that's all that needs to take place. All right, guys, any questions for me? And I think that's what I had for you.
Well, thank you, John. Very comprehensive presentation. I thought it'd be similar to the one that you did for Kailua's community, but definitely a lot of great updates in this one. So I'll start off with a question. So the media nationally has been talking about, or I guess it hasn't been active in a while, the possibility of having to get boosters a year from now, or several months from now. What's the thought about that?
Believe it or not, I was just on a call with the DOH leadership team, and we were talking about that. The bottom line is the mRNA vaccines have been doing a really good job against any of the variants to date. It seems like they've got really good longevity compared to the typical flu vaccine that we've seen previously, where you needed to get a different shot every year. We're hoping that there's going to be better test data that's going to come out of some efforts that are occurring right now to see what the need is for boosters. I'm hoping that the earliest we might see boosters required would be at least a year out, if not 2 or 3 years out. But it's all based on the test data coming back. So what I would recommend is get the shots now and make that happen. And we'll continue to work on the planning efforts for boosters if that's the case. My team's working on that right now. And so we're saying, hey, it took us 6 months to get the 1.6 million doses. How quickly can we make this happen with boosters to hit the same populations? The difference will be at that point, we believe the emergency use authorization would be gone, and there would be potentially mandates in place and the ability to stand up these larger vaccination clinics rapidly, the independent providers that I mentioned, the pharmacies, all that stuff we had to create basically from scratch. And now we've got the template in place. So we think we could do it more quickly. We just need to make sure people are lined up and ready to go to get shots in arms.
Well, open. I don't see any questions in the chat, but if you're not comfortable with verbalizing your question, please feel free to drop it in the chat and we'll ask it. But anyone else have any questions?
I'm good. Thank you.
Okay, thank you, Tehani, for joining us.
No questions.
Yeah, I'm good. Thank you, Pono.
Yeah, I'm good too, Bono.
Okay, thank you, guys. You sure we've got about 14 minutes left? No one with any other questions for John?
I got my dinner waiting on me. I'm good. So sure if he does. My dog's looking at me. Hey, I got to go on a walk.
I'm sure I had questions before the presentation, but definitely appreciate you doing this time. A lot of great data. I'm personally interested to see, I know you guys have a lot of pods out there, but if there's a way that we can put together a pod to support the effort. Are there, I know you folks got to the, I guess the multicultural ethnicity groups. Are there any other groups that you think that are out there that we could help focus on, or is that homeless population or?
Yeah, I mean, there's efforts been taking place since December for the homeless population. We've been doing a combination of Moderna and J&J for the most part for that. So hopefully we think that we've doing a pretty good job of getting to there. I think the other areas in terms of specific population groups. So I think we're looking at some of the churches that target some specific areas. So I know like the Filipino community we've gone to a number of times with Philcom. I think there's the latest things I saw today was looking at one of the Korean churches to kind of look at some efforts there. But yeah, I mean, if you have an idea, just let us know. We can make it happen. All the providers are more than willing to provide support. So HPH has got a bus that they drive out to the site. Queens has got a van that they drive out to the site. The National Guard's willing to help. You name it. If you can come up with an event, we can try to make that happen. It's just the hard part is getting the people engaged. And so, for example, if your preparedness fair was happening next week, I'd say, hey, let's do something at preparedness fair. So it makes sense to me to drive people to existing locations where there's a bunch of people. So the next things that are happening is we're working with the Marshallese community, some sporting events that are hopefully going to take place. So I think we're looking at YPO complex is one of the things that I've heard about. But again, if there's anything along those lines, let us know and we could try to make it happen.
The website, I'm assuming that there's still a large population that doesn't have regular internet. Are there flyers on the website that we can print and maybe distribute to some of those communities that don't have regular internet access?
Potentially. So yeah, if you go to the website, Hawaii COVID-19.com. So this is the main website. If you look on the resource tab, it has multilingual resources. And so one of the things that we've got listed here is all the different materials that have been translated into different languages. It does include things like how do you get a replacement vaccination card in all these languages. People don't have health insurance, screening questions. So if you are looking to get hard copies of these types of things printed out, maybe shoot me an email separately and I can see if you give me the quantity or whatever, I can talk to the Department of Health and see what might be able to work. The other thing they are doing is, if you remember that vaccination like social media post that I showed you, that's been translated into 20 different languages. And so what will happen is, if any of those efforts are happening like this, the team can get that to you in different languages. So you just tell them what language you're looking for, and they can get that into the language that you need to be able to push that out. Okay.
Okay, saved rounds, anyone? We've got 10 more minutes, and I won't hold you to the 10 minutes, but does anyone have any other questions for John?
No, thank you.
No, thank you.
No, thank you. I'm good. Great presentation. It answered a lot of my questions.
Thank you. Make sure you get vaccinated, everybody. Tell your friends, tell your family.
Thank you
Okay,
for
thank you.
sharing information.
Thank you, everyone, for joining us tonight. Go ahead, Glenn.
So one good thing about being as old as I am, it finally got me to the head of a line somewhere.
Exactly. Do you want me to stop recording?
Sure, thank you. You know, John, I'll just say that